we have a couple of the cohort companies in our cohort that are going to just give their pitch for about 10 minutes and have an opportunity for some questions and answers. And Ian, there we go. Hey, Ian. Ian Madom is part of Mockingbird, one of our Accelerator companies, and Ian's going to tell us a bit about it as if he was. And there's Stacy. Hi, Stacy. They're going to just do a little 10-minute pitch for us about Mockingbird. Let me give a little background, just because I almost cannot, given what you guys do. So just so you all, my last company, that not my company, but I was a co-founder of, led by Kirk Keith, was a company, Modio Health, and it was a provider data management and credentialing platform. We were lucky enough to do this without an accelerator, and 4 years later have an exit. Our company was acquired by a very large staffing company in the cloud-based credentialing space. And when I came across their team, I was so impressed with what they've done in this space, and the approach that they're taking, that and having such a great knowledge base about credentialing from my previous life there with my last company, that we brought them into the Accelerator, and we're very excited about working with them moving forward.
Amazing. Thank you for having us today.
Yes, thank you.
All right, everyone. Well, we're really excited to be here. Special thank you, Gary. We've loved every bit of today. I have, as usual, with anything that Innovator MD and GHIN puts out there, it's incredible. So to be here, a part of this network, is very, very special to us, and we are grateful. I'm going to share my screen and dive right on in to what Mockingbird is all about. So give me a moment. Okay. So Stacy Harris, Director of Sales for Mockingbird. I'm joined here today with Dr. Ian Madom, Co-founder and Chief Strategy Officer. Mockingbird, see our tagline here, you take care of patients, we take care of you. We're going to start off because a lot of the audience from most of the sessions that I've gone to are clinicians, and particularly physicians. I can't see anybody in the audience right now, not even myself, but I did wear this white shirt thinking it was a little bit kind of clinical. I'm going to fake a doctor. I am not a physician, but I did wear it, and I would like to put out a diagnosis before we start out to many of you physicians. And Ella, you just touched on it. You're a tricky group. You don't really like change very much. And Mockingbird is essentially changing a process, albeit a broken process, but we are changing a process. So I want to start off with a little question to Ian and hear a little bit more about the background and why you think it is that change is so difficult in the healthcare space.
Yeah, thank you, Stacy. I think that change is hard for people in healthcare, physicians, but all clinicians alike. One of the things that we're trying to control, we don't like the loss of control. And part of that comes from what we do on a regular basis. We're taking care of patients, we're following literature, but it's not a truly controlled process, right? We are going with the best information we have possible, taking care of people, and then, we kind of see what happens, and hopefully we get good outcomes on things. So we like to control what we can control. And when new processes come out, we automatically discount it, saying that's not going to work. A little bit out of fear of losing some control, and a lot out of fear of somebody is just trying to add more to my plate because nobody's in my corner. And that's a lot of what we feel as clinicians out there. And that's true based on history. What George Fernane, our co-founder, and I set out to do is, let's put it through the lens of us as the people who take care of people, and work on a process through our lens, and hopefully lend some credibility there and say, we're trying to make this better. I'm trying to make this better for myself. George is trying to make it better for himself. So hopefully this all works out for everybody.
I love it. Thank you so much for sharing that. So let's go. Mockingbird is a platform and an app I like to put out there for administrators and clinicians to automate the process of managing medical licenses and certifications. Our mission is to improve medicine, patient care, and clinician wellness by eliminating the chaos and continuous education management and delivering high impact learning. I love to show this. We are not credentialing. So what we like to say is here at Mockingbird, we love our friends in credentialing. We have many partners who have actually given us their blessing and are partnering with us because we essentially take over where they end. We are the middle puzzle piece in a large picture that we have found was where there was a huge and enormous amount of burden on the physicians, stress, inefficiencies, and also on the administrators tasked with managing it. What do? We tell you what you need to do, how to do it, when it's due, and then we connect you with relevant learning materials to get it done so that everything else that you learn, since you're continually learning, is exactly what you want to be learning to benefit your careers, your interests, and essentially your patients, which is what you're all in it to take care of the most. The challenges and risks in this space. There's numerous, but as telehealth is on the rise, where our value proposition is extremely recognized, there are even more. Each license has a different date that it's due. Every state is different. All the boards are different. You have expirables, some on your birthdays, some on, when you actually were licensed. Tons of documentation, oftentimes duplicated. I need it from here and there, stored in all different places. Not a full amount of oversight. The risks on that are becoming out of compliance. Recently, there was an example in Delaware where 2 nurses were with lapsed licenses for just 7 months, $180,000 in a settlement to Medicare, and that doesn't even take into all that it was. It's a really big problem, and if you really put the lens in on it, it doesn't need to be so difficult, and that's what Mockingbird is here to fix. So mitigate risks with Mockingbird. We track it, provide tracking and updated license requirements and regulations. We have a rules engine, a proprietary rules engine that is built knowing all of the rules, what they say, putting them in layman's terms, and then applying it to every single cocktail of licenses on your own personalized dashboard. As I say all of this, to anyone out there listening to me right now, if you're not personally challenged with this, maybe you're retired, maybe you have the most fabulous support in the world, you don't even have to touch this. I doubt it, because even still, you have to take the continuing medical education required. What I would say to you is ask around, ask your peers, ask another doctor, ask a nurse. Most importantly, hop down to your med staff office. See how they think about it. Do they go to bed not worrying? I guarantee you the answer is yes, and Mockingbird is here to help. So for you and your organization, you have a credential dashboard. Again, personalized to you, looks super easy, but the back-end engine and our rules engine that supports this with all the algorithms built in is phenomenal, led by an incredibly talented development team. You will have all of your tasks listed step by step. Again, different for each. Each state is different. Automatic notifications coming both on email and on app. And then our CME marketplace, which we're very proud of, because for this, and this is what's super fabulous, is we tag courses with relevant keywords and state relevant metadata. So what's happening is if there is a course and it's needed for Connecticut, it's going to say Connecticut requirement taken. And we do that for all the courses we have. So we're thrilled to partner with many different content providers. We do not create content, we host content. We partner with various groups who have the state requirements, other requirements, very highly vetted, qualified courses. And then also we have wonderful partners like AdaptTrack. They are actually making it possible to get CME credit for just conversations in your normal day workflow. And Inflow, who's also putting an audible ear on everything in a really, really wonderful way. It's not sounding like a robot, it's sounding like an audiobook. So we're really happy to be working with some of these partners. And then the admin dashboard. This is the bird's eye view across your entire organization, showing you at a glance. You can drill down to log in as the user, to see exactly what's due, to print their files, to upload, one-click upload, and also reporting features. And what we're really pleased to say is we take user feedback very seriously. So most of the reporting and everything that you see within development is we have focus groups with these admins, and they're telling us exactly what they need to make their jobs easier. Growth. Really pleased to say that we're finding a lot of traction within our health systems, innovative companies, disruptors. Telehealth is exploding. The concierge services, channel partners, basically anyone who works with clinicians has identified this as a problem area with Mockingbird as a clear benefit. And we're really happy to say that the marketing and the word is out. So we are having increased visitors on our website. And an ask for this entire network and anyone watching today is check us out and spread the word, because it helps customers and partners. So you can see here, growing. We have many paid pilots going on, many already onboarded, ready customers, and plenty of channel partnerships. CME partners, like I mentioned, wonderful content providers that are working with us and enhancing our categories every single day. And then our team. There's a fabulous book that I love, and if anyone is so inclined, please read it. It's called Rare Breed, and they speak of audacity. Audacity is a cocktail of nerve, radical vision, and unshakable self-confidence. It's having the guts and vision to see possibilities where others see boundaries. And I would say that's every one of the members on our team, and just as importantly are our advisors. They are purposefully diverse from a broad range of industry, and we host monthly product boards where they see it, they put their feedback in, they're testing it, they're trying it, and they're letting us know everything that needs to be from the vantage point, and it is very valuable to have this wonderful team. I am right on 10 minutes, which I have to say is not so easy to do. I'd love to open it up for Q&A, and just a special shout out for anyone listening. I will be at HIMSS in Las Vegas all next week with Sanji Silva, our Chief Product Officer. So if you'd like to learn more or speak with us one-to-one, please reach out and we will make some time to be together.
I couldn't have said it any better.
Oh, well, that's a good thing I said it then.
I would like to take this opportunity. We just gave you a little flavor of one of the companies that we have in our Accelerator cohort. But now I'm going to go into closing mode to thank you for attending the session. Again, I would like to thank Uli Chetapalli and Innovator MD, as a sponsor for their conference. This was the first year of the 3 years that we sponsored so far that we had our own half-day session. And our plan is to continue this moving forward with Innovator MD. I hope this gave the audience a flavor of what we're trying to create from a clinician perspective. We do really encourage all clinicians to join our network, get actively involved, participate as investors, as advisors, as mentors, actively get involved in the evolving digital health revolution. And again, this is just the beginning. This is the idea is that this is supposed to foster your interest so that once you join, that you continue to be involved, continue to educate yourself, collaborate, communicate, and actively participate. So thank you. Thank you for sticking with us throughout the day. And we look forward to continuing the collaboration with all our clinician colleagues and startup colleagues. Thank you.